Every day, millions of Americans walk into hospitals with Medicaid. It covers their visit. It pays the bill. Problem solved, right? Not exactly. Medicaid is a joint federal and state program. It covers over 80 million Americans. That's nearly 1 in 4 people. Children, seniors in nursing homes, low-income adults, people with disabilities. But here's the catch. When a hospital treats a patient with private insurance, they might get paid $1,000 for a procedure.
Okay, I see where this is going. And again, I like to give you guys, especially with the academy, the business side of healthcare. So this is how this works with payments. This is where he's going with this. So private pay is going to be lower on the totem pole. Private insurance, right? Humana, Blue Cross Blue Shield, Aetna, those companies are going to pay the most pretty much all the time. And so they're normally going to build that first. And then the second one is Medicare, Medicaid, and private pay. Now, you're saying to yourself, well, what is it that is making Medicaid patients forcing hospitals to go out of business? It's not forcing them to go out of business at all whatsoever. I'd argue that Medicaid pay, while significantly less than private insurance pay, is probably all they really need to function if they just did everything at Medicaid pay. But then again, if I said that out loud, again, people would be all upset, they'd be up in arms, and I can't believe he said that. But if you break it down, and I've been saying this for a while, if America, and it's just, this is an American problem, if we figured out how to help doctors ease that load of paying back that medical debt, they probably wouldn't need to make $500,000 a year. And then your CEOs of the hospitals, you're saying, well, they make a lot of money. So I have been on record saying that they do make a lot, but I've talked to a hospital CEO last week and he heard my videos. He said, Henry, we take on the liability. So when there's a problem, everyone's mad at us for what we did. And I said, well, how much do you make? He gave me a range. I said, and do you think that that range of money is worth you taking on liability for a hospital? He says, yes, I think it's actually worth more. And he broke it down for me. He said, well, something goes wrong at our hospital. Who's the first person they name? I said, the CEO. He says, correct. He said, something goes right with the first person. He said, but if the hospital fails and I lose my job, I'm out of a job for 6 months to even sometimes a year. Sometimes you can never actually get a job again. I said, now I'll be honest, because I never worked for a system. I didn't know that. Super interesting to hear that because in my mind, I'm always thinking if we paid the C-level executives less, we'd have a bigger margin and more way to treat people who are indigent. The real problem, though, is why hospitals are going broke and why they go out of business is because we have a program in place called EMTALA that forces, and I talk about this a lot, that forces a hospital to see anyone who comes into the hospital. That's going to be your biggest problem. So what they've done is they've created this thing called emergency Medicaid. So when you go to the hospital with no insurance, and this is, we're going on a little sidebar here for all of you people who continue to see messages that you call them immigrants should not have insurance. For the life of me, you cannot freaking get it. Like, it's not like they're just going to give you insurance for the rest of your life. There are a lot of people here with no insurance who go in and they need chemotherapy. They cannot get it because they don't have status as an American citizen. So this is a fact, right? You have to understand that. There are some states who will give you some limited insurance, but it's not going to actually help you long term. It's very short term. This one emergency room stay, and even that, when you have to go back and they get a bill, they'll never be able to pay that. So just things to remember. But in terms of do hospitals make more money or will Medicaid put them out of business? No. The thing that's going to put hospitals out of business, and I've continued to say this, is not people who have insurance. It's people who don't have insurance that the hospitals have to continue to see, and then you pull their government funding. That's literally what's going to do it. Like, that is 100% going to do it. And you're saying, well, Henry, well, they need to see everybody. I agree they need to see everybody. But that system only works when we have enough hospitals in place that we don't have to have as much diversion, right? I've got patients right now in Fayetteville, Georgia, who are being sent to Grady, downtown Atlanta. Well, they're not our patients, but people that call in or talk to me because there's no trauma hospital between here and Grady, right? Like, literally, that's what's going to cause people to go out of business, not this other stuff. But insurances are put in place so that when people go there for their services, that the company will make money. They will make a profit. So let me just clear that up too. This other stuff is not true. They will make a profit. But the reality of it is, and this is what I believe is going to happen, they're going to pull your insurances. So people are going to not be able to have insurance anymore. And once you don't have insurance, you still go to the hospital because you're going to go to the hospital more now because you can't go to the doctor's office without paying out of pocket. So you're just going to go straight to the emergency room because there's no copay. So not yet. So you go straight there. You'll get stabilized. You'll go home. It'll become a revolving door. That's what's going to put hospitals out of business. Sooner than later. It won't take as long as you guys. People are telling me 10 years. It won't take 10 years. It may not even take 5 to 7. Like I'm being completely honest with you because hospitals are already shutting down. So imagine going into an ER that has 200 people a day and 100 of them have no insurance, but you have to see all 200. But here's where it gets tricky. You don't know who has insurance, right? So if 100 of them come in, or if all 200, let's just say 100 come in on a stretcher and they all have emergency things that have to be taken care of, you don't know who has insurance. You have to see whoever has the most critical at that time. That's what's going to do it. That's what we have to fix. So that's why I am one who says healthcare for all. Figure this out. And if you're asking me, how do you fix it? I've been saying this for a while. You can't undo things that have been done, but this is what we can do. Your insurance should cost X amount if you make less than 10 grand a year, 50 grand a year, 100 grand a year, 250 a year, $500,000 a year, $1 million a year, and so on and so on. You tier that, you'll be fine. And if you're super rich and you say, I'm not paying it, I don't want insurance, well, just don't pay it. That's something that you can decide. But ideally, if you look at how America is built, you have the 1%, which is why we always say the 1%, then you pretty much have everyone else, right? And so it won't be a problem. It'll stabilize itself. It's not something you have to worry about. I'm not saying make a billionaire's insurance cost 20 grand a month, but realistically, if they could pay they could pay 5 grand a month, it would cover a lot of people. I think that would be fine. And I don't think they'd have a huge issue with that. Because if we're being honest, their concierge medicine as they use now is actually about that price anyway. So it wouldn't change much. And it's a complete write-off for them, right? You continue that motto of insurance being a write-off, they'll be fine with that.